Regulation 20, the knowledge and attitude of graphical warning signs on tobacco among males working in the Sri Lanka Railway Department. The presenting author is Imhani W.A.Y.
Good afternoon. I'm going to present our research on the knowledge and attitude of graphical warning signs on tobacco among males working in Sri Lanka Railway Department, which I have conducted with two of my colleagues from Faculty of Medicine, University of Colombo, with the guidance of Community Medicine Department. Let me reiterate some well-known facts regarding smoking. 1 in every 3 people around the world is a smoker. It sums up to 1.1 billion people over the world are smokers. And each year, 7 million deaths have been recorded due to smoking. Unless the current trends are not reversed, it's expected to these death rates raise up to 10 million deaths per year by the age of 2030. Sad truth is, 70% of these deaths are occurring in developing countries. According to WHO, there are over 2 million tobacco users in Sri Lanka, and over 3 billion cigarettes were sold within the year 2017. It's according to the annual report of Ceylon Tobacco Company, which is the cigarette monopoly of Sri Lanka. Therefore, Sri Lanka became signatory to the FCTC on 2003. With regard to the Article 11 in FTCT, Sri Lankan government implemented NATA Act on 2006. There, with the objective of eliminating tobacco-related harm. Regarding the policies of packaging and labeling of tobacco products, these regulations requires 4 categories to address, namely pictures of hospitalized infant, pictures of hospitalized men, pictures implying the impotence, and pictures of real patient with oral cancers. It also further states that these graphical warning signs have to cover the packets of the cigarettes more than up to 50 to 80% of the package, and also it should be rotated in every 6 months. Although it's been 14 years since the enactment of these policies, we couldn't find any research data on the public perception of graphical warning signs. Therefore, in order to assess this knowledge gap, we conducted our research. We created a self-administered questionnaire, and using that, we selected 110 male government staff working in the maintenance yard of Sri Lanka Railway Department, Ratmalana, and then distributed it, and the information was gathered using 5-point Likert scale, and the knowledge and the attitude was assessed. This is the basic demographic features of our population, and out of the 110 participants, 50 of the participants were smokers. It was evident that graphical warning signs, including both text warnings and pictorial warnings, have been able to grab the attention of majority of the smokers and non-smokers. Of the participants who were less attentive to those graphical warning signs, 68% stated that the pictures displayed were unpleasant to look at, and 31% stated that letters displayed were too small, therefore they couldn't read. In order to assess their knowledge regarding the diseases that can be caused by tobacco, we displayed 10 diseases, among which out of 5 were depicted on graphical warning signs. And the participants seem to be well aware about the lung cancer, oral cancer, cardiovascular diseases, and erectile dysfunction. But very few want to know about the diseases that can be caused by tobacco smoking. Diseases in children that can be caused by tobacco smoking. And then, in contrast, there was comparatively less knowledge on the diseases which were not depicted on graphical warning signs, namely chronic respiratory diseases, excessive raging, gastritis, pneumonia, and diabetes mellitus. We further assess the attitudes of smokers and both non-smokers. So majority of the participants agree with that. The cigarette packet should carry health warnings, and these pictorial warnings should cover more than 50% of the package, and the graphical warnings are better than text warnings. Finally, we display the graphical warning signs currently being in used in Sri Lankan government and ask the participants to read them according to their knowledge, to convey the health message, to imply the hazard, and to aid to quit smoking. There we found out the pictures with the pictures of real patients implying the oral cancer seems to be more effective than the pictures of hospitalized infants and pictures implying impotence. In conclusion, our research results was in line with most of the other research results done internationally, including Hammond's research in 2003, where the participants, despite of their smoking status, agreed that they have noticed the graphical warning signs and they had positive attitude to the graphical warning signs, and also agreed the fact that pictorial warnings are better than text warnings. And also in our population, significant number of participants in our population were aware of the diseases depicted on the graphical warning signs than the ones were not. We would like to share some limitations that we had. Because of the limitations in time and resources, our sample size was small, and we have assumed that all these graphical warning signs have printed on equal amount. If it's not, the results have to be calibrated accordingly, and the information gathered here is insufficient to identify the causal relationship. Thus, we have only commented on the correlations. A validated questionnaire is yet to be developed for particularly for our objectives. So we would like to do some suggestions for further researchers. These future researchers need to be done involving larger study population and also involving disease conditions like diabetes, COPD, and gastritis like conditions, and we have to include them and see whether it's effective, and depending on the results we have to incorporate them in future graphical warning signs. And also we would like to suggest that the less attention grabbing graphical warning signs currently in use need to be improved and be more effective. So if there are any questions, I will go ahead with questions.
Sir?
Okay, so what was your main objective? Was it to find out whether the graphical illustrations worked in limiting their tendency to smoke?
No, sir. We wanted to assess whether it has the graphical warning signs were effective on them, like whether they have perceived what has said in the graphical warning signs, and whether they have noticed that, whether they have read the signs. That's what we wanted to check, sir.
So what what is the objective of that? Anybody with I'm not trying to be sarcastic here, but anybody who sees it would see, can have eyesight, can see that. But isn't the objective to see whether these signs would prevent or reduce smoking? Isn't that what we really want to know? Isn't the final objective of a warning to see whether putting these pictures has actually have reduced the temptation to smoke? Isn't that actually what we want to know?
Yes, but what we thought was like this has been displayed for like 14 years, and whether the smokers and non-smokers are they are receiving the message that the government want to say, like.
Absolutely. No, I agree with you, but I would have personally, what I would have really liked to have, the information you will want to gather is absolutely important. But whether it is effective or not, I think a better way to find out whether it's going to be very difficult is a market surveillance to find out whether after the pictures were put on the cigarette packs, what has happened to the income of tobacco company. Rather than asking people, or you to ask people how many people have actually quit smoking or reduce smoking. Were you able to ask that from these
Yes,
people?
we asked that, and there were 7 past smokers, and they states that that it also helped them to quit smoking.
So in your group, there were people who had actually quit smoking because of the pictures, is it?
Yes, they stated so.
That's probably the most important result of your study, but it was not presented.
You
Uh,
didn't.
You didn't present that in your study, though it is one of the most important results of your study, I would think. Yes, I also agree with Anuja. Perhaps something you could have asked is, would you, now there are 50% of them are smokers. So question like, would you give up smoking? Would you think of giving up smoking because you saw these things? Did you ask that? Did you ask them, prospectively, would you
We
give up?
asked whether it has affected them, like whether whether it has reduced the number of cigarettes that they were usually buying and like that. So there were some parts, but the response rate was a little bit low. That's why we didn't include it here, and that's why we didn't try to concentrate.
It would have been interesting to ask the non-smokers whether they smoked previously and whether they gave up because of this particular, whether they gave up and then whether it had any relationship to these pictures. And the smokers, whether they are planning to give up or whether they would give up and whether how much this would affect their, smoking. That type of information is probably add to your study, as Professor Anuja pointed out. But you also mentioned some correlations, but I didn't notice that you presented any correlations.
Actually, madam, there's a correlation between the there was a significant difference between the participants who had the regarding the knowledge depicting on the graphical warning signs
Okay.
and the diseases which were not right.
All right.
But
You also said that smoking gives rise to diabetes. Is that correct?
madam,
Because you were going to add that into your next set of packets. That I think you put diabetes as one. I had no idea that smoking gives rise to diabetes.
indirectly, madam, as while we were reading, we found that indirectly the smoking can worsen diabetes, and therefore the complications of diabetes can
That's
cause death.
different. So when you ask them whether whether they knew whether diabetes was a cause of smoking, that in fact if they said no, I think that you can't say that it's wrong. Worsening the consequences, of course, vascular consequences I can expect. Okay, so what is your important application that recommendation, recommendation you make from your study?
We would like if we can do more researches involving
No,
like
no, no, not the future researchers, but from your study a direct application.
we would like to instead of using the pictures of infants and pictures of impotence, we would like to use more like either develop it more or use the more effective science more.
Yeah, maybe improve those particular pictures. Okay, right. Thank you.
Thank you.
Thank you. With that, we conclude the final oral presentation for the session and for the conference 2020 of Ceylon College of Relations. I would like to thank our judges. I would like to thank our judges, Professor Inu Kapuria and Professor Anuja Premwal. Thank you, sir. Thank you, madam.